Immigrants now make up about 20% of the population in Canada, and we know that immigrants who arrive in Canada are typically healthier than the Canadian-born population. We don't know, though, whether or not that applies to children and youth who are immigrants who arrive in Canada. And this is really important to study, and this is called the healthy immigrant effect. So we have this growing body of evidence that suggests that immigrants have better health outcomes than Canadian-born, but we don't have a lot of information about children. And specifically, we don't have information about their risk of injury, who's getting injured, what types of injuries that we're facing, and we know that injuries are so common in children and youth. And so this study, it was intended to fill that gap. So this was a population-based study using health and administrative databases that are linked and available at ICES, including the Immigration, Refugees and Citizenship Canada Permanent Resident Database. This is a database that links health information for all permanent residents living in Canada from 1985 to 2012. And it does not include temporary residents, it does not include undocumented residents, but anybody who has OHIP eligibility who has moved to Canada, and specifically Ontario. We looked at children and youth ages 0 to 24 years who were in Ontario from 2008 to 2012. And then we looked at whether or not they had an emergency room visit, if they were hospitalized, or if they had an in or out of hospital death that was related to injury. What we found is that immigrant children and youth actually have much lower rates, in fact about half the rates of injuries compared with non-immigrant children. This was expected with the healthy immigrant effect. However, what we did find that was surprising is that immigrant children and youth have different risk factors for injury compared with non-immigrant children and youth. Specifically, low income, which is associated with injury in the general population, was not associated with injury in the immigrant population, and in fact high income children were at greater risk of injury. Additionally, we found that children between the ages of 0 and 4 who were immigrants were at greater risk of injury compared with the older adolescent population, which is the opposite of what we typically find in the general population of children and youth. Overall, we found that children and youth who are immigrants have much lower rates of injury compared with non-immigrant children. And this supports the healthy immigrant effect that has previously been described in adult populations. This is also really important because it helps us to develop strategies that are targeted specifically towards immigrant children and youth for injury prevention strategies. It's also important because we potentially can study further why it is that immigrant children and youth are at lower risk for injury, and what can we learn from that to apply it to the Canadian-born population to help reduce injuries in that population. On the flip side, it's really important to identify whether or not these lower rates of injury are because of lower physical activity rates. So is it that children and youth who are immigrants are not playing in playgrounds, they're not participating in community-based physical activity programs, which are things that we want children to be doing for healthy and active development. Another really important implication of this study is that do immigrants have different health-seeking behaviors compared with non-immigrant children? So we saw higher rates of emergency room visits in non-immigrant populations, but is that because immigrants are having difficulty accessing the healthcare system? Are they afraid to go to the emergency room and seek care for injuries? So we need to explore this further, and it's going to be a really important step in future research.